So first, welcome so much. Welcome to our February NF Knowledge Series webinar, Diagnosed with Schwannomatosis. This is a new monthly educational webinar series that's been designed by us here at the Children's Tumor Foundation for patients and families living with all forms of NF. My name is Kate, and I work with CTF in patient education and engagement, and I'll be your host today. Closed captions are available and provided by a live captioner. You'll just need to hit the CC button at the bottom of your screen to access those. We will record this today and it will be shared with everyone, both who is here live and everyone who registered. It will also be made available on our YouTube site, so publicly available to folks after our conversation today. So let's get into it. So today I am very excited to welcome Dr. Carlos Romo, as well as two individuals here with us who are living with schwannomatosis, both Dale Berg and Dave Clowder. This week or this month, they're going to be presenting on Diagnosed with Schwannomatosis. So we're going to start with Dr. Carlos Romo, who is an assistant professor of neurology, oncology, and medicine, and the director of clinical research at the Neurofibromatosis Therapeutic Acceleration Program, which you may have heard referred to as NTAP at Johns Hopkins. He will discuss recent changes in our understanding of schwannomatosis and how that impacts diagnosis and management for patients. Dale Berg and Dave Clowder are volunteers and friends of CTF, both living with schwannomatosis, who will also be joining us for a conversation today as well. So we will start with Dr. Romo. Take it away.
Thanks, Kate. Can you guys see my presentation, my slides?
Yep, looks great.
Perfect. Well, it's an honor to be with you, and I thank Kate and CTF so much for organizing this and for inviting me to be a part of this NF Knowledge Series webinar. My task is to give a very brief overview of schwannomatosis, and I will try to keep that overview within the next 20 minutes. That way we can have more time for questions and discussions as well. And one thing that I will focus on is the NF schwannomatosis that are not NF2 related and are not NF1, and I'll talk to you a little bit more about that. I don't have any relevant disclosures to this presentation. So I thought I'd start with a little bit of history about medicine and schwannomatosis, the medical field and neurofibromatosis. So NF1 was the very first form of NF that was described, and it's been many, many years, thousands of years since we have the first description of what we think was a person with NF1, but it was not described formally until 1822. And then NF2 was also described later on, but it wasn't very clear at all that there was a difference. And some people were calling NF1 peripheral NF and central NF for NF2. Later on, we understood better that there were differences and better descriptions of what happened in NF1 and NF2 came about. And not only until 1996, so in the recent past, did we actually find out that NF2 is not the same as the other forms of schwannomatosis that we'll talk about today, and that will be the focus of our conversation. And lastly, the most recent change in the classification and the nomenclature and how we code and classify the different forms of NF came in 2022, when a large group of experts were consulted, including patients and family members, participated in a process called an E-Delphi process that reviewed the new criteria and accepted this new classification of NF. So NF, in many cases, is considered to be an umbrella term that encompasses all these conditions. Some people prefer to keep the schwannomatosis separated from neurofibromatosis because people with schwannomatosis do not develop neurofibroma. So it's kind of confusing that we're including schwannomatosis as part of the neurofibromatosis when there's no neurofibromas in schwannomatosis. However, a lot of people still consider schwannomatosis as part of the umbrella term neurofibromatosis. And so there are different forms of schwannomatosis, but today we're going to focus on LCTR1 related and SMARCB1 related schwannomatosis, and I'll talk to you a little bit briefly about the others. But I thought it was important to discuss this history of NF for two reasons. Number one is that schwannomatosis is clearly now a recognized distinct process, distinct entity from NF1. And there are different forms of schwannomatosis. That's very clear to us now. And also because I'm shocked that we just were able to describe this and classify this about 30 years ago, not even 30 years ago. And so what that tells us is that unfortunately, we don't have a lot of knowledge about schwannomatosis in general, but we're learning a lot more and more these days. So I hope to present some of the data that we know of schwannomatosis. And I formatted my presentation so that it would be in the forms of questions and questions that I frequently get asked in clinic when I'm seeing people with schwannomatosis. So I thought the very first basic question is, what is schwannomatosis? So schwannomatosis is itself an umbrella term for different genetic conditions that cause tumors to grow over the nerves throughout the body. They are typically caused by variants on gene 22, so on chromosome 22, and there's different genes there. And we use the word pathogenic variants now, more recently, as of the last few years, to describe what was used to be named mutations. So whenever you hear me say variants or pathogenic variants, that means mutations. And pathogenic just means that it causes a condition or a disease. So it's important to clarify that. And the genes that we know of, including SMARCB1 and LCTR1, are located on chromosome 22. So in addition to that, we know that schwannomatosis is characterized by the development of benign tumors called schwannomas. And these tumors can occur in different places of the body, including the hearing nerves, but that's not characteristic of SMARCB1 or LCTR1 typically. Most of the symptoms associated are related to tumor compressing nerves, so that can cause pain, but it can also cause other problems like weakness or numbness. And it's not only compression of the nerve which can cause the symptoms. More and more, we're learning about some possible inflammatory markers and other conditions that happen within the tumor that may cause pain, even when the tumor is not growing or causing more pressure on the nerve. Now, most people with schwannomatosis are diagnosed during adulthood, but the symptoms of schwannomatosis can occur at any time. And maybe we'll talk a little bit about the experience of our volunteers today about when and how they were diagnosed with schwannomatosis, which can sometimes be a difficult process. So how common is schwannomatosis? Here we have a list of the different types of schwannomatosis that we'll briefly discuss today. By far, the most common form of schwannomatosis is the one called NF2-related schwannomatosis, and that happens in 1 of 25,000 births approximately. And the other two forms of schwannomatosis for which we know there's a specific gene associated with them, including SMARCB1 and LCTR1, are much more rare. 1 in 280,000 births for SMARCB1 and 1 in 500,000 births for LCTR1. So they are very rare. So how do we actually make the diagnosis of schwannomatosis? So like I said, in 2022, a paper was published describing how people can make the diagnosis of schwannomatosis. And there are tables and algorithms that we follow in clinic. Our genetic counselors and our providers in clinic, nurses, doctors, physician assistants use to make the diagnosis. But I thought I'd try to simplify this a little bit. So let's talk about one case. We can diagnose someone with having schwannomatosis if they have one schwannoma confirmed by pathology. Pathology means that a physician called a pathologist who takes a look at the tissue under the microscope looks at a biopsy or a tumor sample and confirms, yes, under the microscope, this is a schwannoma. So one schwannoma must be sampled, sometimes biopsied or removed, and confirmed by pathology to be that, a schwannoma. And then if you have genetic testing in another tissue, usually we call that an unaffected tissue like saliva, a buccal swab sample, or a blood sample, and we find one of those two mutations or pathogenic variants in LCTR1 or SMARCB1, then the diagnosis can be made. That's one way of making the diagnosis. Another way of making the diagnosis is if we take two anatomically distinct schwannomas and we find that in the tumor sample itself, there are the exact same LCTR1 or SMARCB1 mutations. So let me explain that. Let's say we remove a schwannoma from someone's arm and another schwannoma from someone's leg. And we send both tissue samples to the lab, and we find out that both of those tissue samples have the exact same pathogenic variant in LCTR1 and in SMARCB1, then we can confirm the diagnosis. So two anatomically distinct areas means just that they shouldn't be together. There shouldn't be any question that they are the same tumor. Scenario 3 is when you don't meet the criteria for NF2, SMARCB1 or LCTR1 related schwannomatosis, and also you don't have another mutation called DGCR8 in your blood or saliva or other tissues. And we find that you have something called loss of heterozygosity, meaning that there's a problem on chromosome 22 in two anatomically distinct schwannomas. And also, you should typically have an NF2 variant in each of those tumors that was not detected on an affected tissue. This scenario is a little bit more complicated, and a lot of the genetics can be a little bit complicated, but with time and just reading a little bit, and we have resources for you, they're pretty easy to understand. Now, there's another kind of schwannomatosis called schwannomatosis not otherwise specified. And it's not that it's different. It's just simply when a genetic test cannot be performed, it's not available, or there was insufficient sample. If there is no possibility of getting genetic test results, but you meet the criteria for schwannomatosis because you have two or more lesions consistent with schwannomas, with one of them being confirmed by pathology, then we say you have schwannomatosis not otherwise specified. Now, when genetic testing is possible and has been performed, but it doesn't show us one of the two mutations or pathogenic variants that I spoke with you about, then we say that it's schwannomatosis not elsewhere classified. So what does this mean if you had genetic testing and we can't find a pathogenic variant? That either means that the genetic testing failed because of some technical difficulties, or it means possibly that we just can't find the mutation because we don't know all of the mutations that potentially cause schwannomatosis. So SMARCB1 and LCTR1, when they are germline mutations that are affecting all of your cells, they will show up in about 80% of the cases, but in many cases, it doesn't. You might also have heard your providers mention other terms in genetics called mosaic schwannomatosis, segmental schwannomatosis. Maybe someone has talked to you about penetrance in schwannomatosis, expressivity in schwannomatosis. And I'll take a stab at explaining some of these terms, but you should always consider talking to your providers about what these terms mean in your specific case and asking for a referral to genetic counseling if necessary. That's always appropriate. So let's start with a term that is frequently used to describe a form of schwannomatosis called mosaic schwannomatosis. Mosaic schwannomatosis means that you were conceived with normal cells, that you did not inherit this from mom or dad. So cells from dad and cells from mom start creating you as an embryo. And as things start dividing and the cells start dividing and growing, one of those cells later in the development makes a mutation. And depending on where in the embryogenesis this happens, depending how further along you are in the development, the mutation can only affect one part of your body or most of your body. So if it happened very early on, it probably will affect more cells in your body, and it might be easier for us to find that mutation. But if it happens when you're already fully developed, you may get something called segmental schwannomatosis, which means that only a part of your body, perhaps just your leg on one side, perhaps just one arm, is affected. And I'll be happy to take questions about this because this is not something that's usually straightforward to understand. Now, what about penetrance in schwannomatosis? What penetrance means is that in schwannomatosis, both SMARCB1 and LCTR1 are genes that we know have incomplete penetrance based on unpublished evidence. And what this means is that there are people out there who have an LCTR1 or SMARCB1 pathogenic mutation that was found because we were looking for something else and we found it incidentally. And that doesn't mean that they will necessarily develop schwannomatosis, but they could potentially develop schwannomatosis, which means, again, just to summarize that, someone could have an LCTR1 or a SMARCB1 pathogenic variant, but not develop any schwannomas. That is what incomplete penetrance means. Some do, some don't. Then there's differences in expressivity or expression of schwannomatosis. What does that mean? That means that in someone who develops schwannomas, they can have a more severe phenotype, meaning more tumors and others can have less tumors and everything in between. So variable expression or expressivity means that it can manifest differently in different persons. And if you know someone else with schwannomatosis, you probably know that some people are a little bit more affected than others, and that is due to difference in expression in schwannomatosis. Again, if you are thinking about this and have more questions about that, feel free to ask your providers for a referral to a genetic counseling visit, or even prenatal counseling if you're thinking about starting a family. Another basic question is, what are schwannomas? So the way I explain schwannomas to my patients is, if you think of a nerve as a cable, well, you know, the cables will have a copper wiring inside and then a protective plastic sheath. And our nerves are pretty much the same. There's the body of the neuron, it has an axon, and that axon travels to your muscles or your skin, and it provides motor signals and sensory signals so that you can feel and move. And that axon has a protective sheath of myelin that's produced by Schwann cells. So schwannomas are tumors that occur in the sheath of the nerves from those Schwann cells. And here on the right side, you can see a photograph. This is what the pathologist looks at when they're looking at in the microscope. This is a sample of someone's schwannoma where we see an increased number of these mature Schwann cells. There can be a capsule associated with the schwannomas that we see here. There may be a few number of white blood cells, but typically schwannomas are composed mostly of mature benign Schwann cells. There are different forms, and some people will call them ancient schwannomas or cellular schwannomas, and they might look a little bit different under the microscope. But talking about that is a little bit outside of the scope of this talk, so I'm not going to delve into that in detail. Now, schwannomas can also occur anywhere. Typically in non-NF2 schwannomatosis, so in SMARCB1 or LCTR1 schwannomatosis, we frequently see the schwannomas happen in the peripheral nerves. Peripheral nerves are the nerves in our legs, in our arms, the legs in our chest, or abdomen, or pelvis. Sometimes we see them close to the spine, and we call those paraspinal schwannomas, like in this picture in the middle. And in some cases, we can even have tumors that are schwannomas inside the brain or the skull, called cranial nerve schwannomas. And some people can develop facial nerve schwannomas, trigeminal schwannomas, and in some cases, even vestibular schwannomas, which are more characteristic of people with NF2-related schwannomatosis. A few other questions that I'll briefly discuss is my schwannomatosis different from NF2? And the answer is yes. If you have SMARCB1 or LCTR1 or chromosome 22-related schwannomatosis, it is different. People with neurofibromatosis type 2 or NF2-related schwannomatosis develop other tumors as well, such as meningiomas and ependymomas, that are less seen in people with schwannomatosis, although meningiomas can also be seen in people with SMARCB1 schwannomatosis. And in LCTR1 schwannomatosis, sometimes people, but it's just very rare, about 1 to 2% of people can develop vestibular schwannomas on one side or the other. Another question is, can my schwannomatosis change from LCTR1 schwannomatosis and with time evolve into something else like NF1 or NF2-related schwannomatosis? The answer is no. If you were born with SMARCB1 or LCTR1 schwannomatosis, that is the type of schwannomatosis that will stay with you, but it won't change or progress into NF1 or NF2. And therefore, if you have SMARCB1 or LCTR1, you shouldn't worry too much about the complications and the manifestations we see in the other forms of schwannomatosis. Another question I get asked sometimes, even from some physicians, is if there's someone who has a single schwannoma, one schwannoma, does that mean I have schwannomatosis? And the answer is no. That does not necessarily mean you have schwannomatosis. As I mentioned to you when we were talking about the diagnostic criteria, ideally you should have 2 or more schwannomas to meet the criteria. Schwannomas are not cancerous tumors, they're benign tumors. There have been very rare cases when a schwannoma converts into a cancerous tumor, especially that has happened in SMARCB1-related schwannomatosis. And I had a patient who had cancer from LCTR1 schwannomatosis, but that's incredibly rare. And therefore, in many cases, we don't need to biopsy these tumors, but in some cases we do. And speaking with your providers is important to make that determination. I won't deal too much with the guidelines related to monitoring schwannomatosis, but there are different things that we think about when we meet a person with schwannomatosis in the clinic. And there are no strict guidelines. The European network developed a series of guidelines that was published in 2022 that I encourage you to read. It's a very simple and easy paper to read. It's not full of complex medical terminology. And you can always share this paper with your primary care providers or anyone else who's interested in learning more about schwannomatosis. What are the treatments for schwannomatosis? Unfortunately, there are no established treatments or FDA-approved treatments to shrink schwannomas. And so we focus primarily on controlling symptoms. And as I mentioned before, the main symptom is pain. So pain management is a big part of the care of someone with schwannomatosis. Another thing that I usually recommend people with schwannomatosis to consider is to be evaluated in a comprehensive and multidisciplinary center with a group of physicians that has expertise in schwannomatosis care. You might not be close to one, but at least consulting with a comprehensive center once might be sufficient to get a better understanding of how you should be monitored and perhaps how you should be treated. In some cases, surgery is necessary, and I know several patients of mine have had many surgeries to remove schwannomas. But just because you have a schwannoma doesn't mean that you must have surgery to remove it. So you have to be very thoughtful, and your providers especially have to be very thoughtful and consider when a schwannoma needs to be removed and when it doesn't need to be removed. And another strong recommendation that I give my patients is that ideally, if you are considering having a schwannoma removed, that you try to go to a comprehensive center where there's a neurosurgeon or a plastic surgeon with expertise in microsurgery for peripheral nerve sheath tumors and knows about nerve sparing procedures and can do them safely, because surgeries can sometimes result in damage to the nerve itself and causing more problems. Lastly, you should consider participating in a clinical trial. And so moving forward, I'll talk to you briefly about how to find clinical trials, but moving forward, for the treatment of pain, your providers may talk to you about medical treatments or pharmacologic treatments, and those would be medications to try to control your pain. But you should always also consider non-pharmacologic treatments, and there are many options out there that have been proven to be beneficial in controlling pain. So it's not just pain with medications, pain management with medications. Exercising, stretching exercises can be helpful. Acupuncture, meditation, and relaxation techniques. Sometimes cognitive behavioral therapy to cope with the pain can help. And in some cases, even natural supplements can be beneficial. So be sure to discuss all these options with your provider. So how do you actually find clinical trials? There's a couple of options. One is to use this website called clinicaltrials.gov. And if you see this website, this is the homepage. If you land in this homepage, you can type here under condition/disease the word schwannomatosis, click search, and it'll show you all the available clinical trials that are either active and recruiting or active because there are patients being evaluated but not currently recruiting. One of the things you have to be careful with is that you want to make sure that you're looking at clinical trials for you might qualify for. So as part of schwannomatosis, you'll see some NF2 related schwannomatosis clinical trials for which you may or may not be eligible to participate. And this website can also show clinical trials outside the US. So there are some trials in China and places where you may not be able to visit once a month for evaluations. So be careful as you're considering that. You can use the filters that are on the left side of that webpage to find the study that you're looking for. If you click on one, for example, this screening trial for pain relief in schwannomatosis, also called the STARFISH study, it'll give you much more details about what is being investigated in these studies. The second option is obviously to register for the NF registry that is coordinated by CTF. And I won't talk too much about this because Kate will talk to you about the NF registry, but I think it's incredibly important for you to register so that you can be updated on potential clinical trials. So one of them that was not yet fully published, but a couple of abstracts are available from international meetings, was looking into tanezumab. This is an antibody against a factor called nerve growth factor, or NGF. And the goal of this study was to assess whether the use of tanezumab in people with schwannomatosis could help with their pain. And so 9 people participated, 7 of them were women, and their median age was 44, meaning half of them were younger than 44, half of them were older than 44, and they were asked, can you rate your pain from 0 to 10? And at baseline, when the study started, their pain was at 7.6 on average. After the intervention, some of them, and that intervention was either tanezumab or placebo to start with. And at the beginning, for the people who took the placebo, they did not have much improvement in the pain. The pain rate only decreased by 0.4, not even a point. However, the people who took tanezumab their pain improved by 2.5. Now, not everyone improved 2.5. Some improved a little bit more, and some improved a little bit less. But this is the median decrease in pain score. Unfortunately, 9 patients is not a lot of patients, and that was in part because of the pandemic. The study was open exactly when the pandemic started, and so recruitment was difficult. And so because it's such a small group, the results lack statistical significance, and a larger trial is needed to assess this. So one study that anyone with schwannomatosis should know about is the STARFISH platform trial. This is a trial evaluating different medications to treat pain. It's a phase 2 study, multi-arm study, placebo-controlled, and a platform screening trial. Maybe during our conversation, I can explain all these terms. I don't want to take too much time, but it's important to understand what that means. And basically right now, the study, which is being conducted at Massachusetts General Hospital by Dr. Scott Plotkin, an expert in schwannomatosis care, includes 2 medications. So Toximab, which is an infusion you get IV, and Erenumab, which is a subcutaneous medication that you inject under the skin. And there's more to come. We don't have results about that study, but if you're interested in participating, again, if you go to the clinicaltrials.gov website, it'll give you the information to contact the team at MGH and consider participating in that trial. Now, if you need more information, you can always use the resources that CTF has available. There's one that just came out on Diagnosed with Schwannomatosis, and it's a booklet that you can print, and it has a lot of different information about the different kinds of schwannomatosis. And I encourage you to look that booklet up at the CTF website. There's also some information in the International Schwannomatosis database, and you could consider evaluating that and even registering. The website is schwannomatosis.org. With that, I'll stop. I know I covered some of these topics very superficially, but we'll have time for discussion, and I'm happy to take any questions.
Excellent. Thank you so much, Dr. Romo. I am going to invite Dave and Dale to, well, here we go. I'm going to fix all my pinned videos here. And I am going to spotlight, yeah, that's fine. I'm going to spotlight us so we can have a little conversation, and that will include answering some of the questions that I've seen in the Q&A, but also some that we've discussed before and been talking about in advance of this conversation today. So thank you, Dale and Dave, for being here. I thought maybe we'd start if you each want to take about just 1 minute. I know that's tricky, and introduce yourself to everybody and let them know kind of who you are and like maybe 30 seconds of your story.
I'm Dale Berg. First had symptoms of schwannomatosis in 2003, 2004. I had a sort of a misdiagnosis in retrospect. Finally got diagnosed in 2015 after sort of ignoring it for years, and been participating with CTF since about 2017.
Thank you, Dale. Dave, why don't you introduce yourself?
My name's Dave Clotter. I live in Myrtle Beach, South Carolina, and I had pain in my leg, like sciatica pain, and went to my doctor, got an MRI, and that was in 1997. And it took me till 2000 to figure out that I had schwannomatosis, because other problems would come up. But I had surgery on the first one. But yeah, that's how it's a long.
I know it's very tricky to say introduce yourself in 1 minute, especially when you're living with schwannomatosis, because I'm sure many can relate to the very long saga of the diagnosis process. So thank you both for being here. I really appreciate it. I thought we would just start with one of our questions that the four of us developed was talking about whether these schwannomas, when you're living with, and maybe there's a difference between LZTR1 or SMARCB1, so we can speak to that, but whether schwannomas will continue to sort of show up and develop over the lifespan, or if there's a certain time of life where we might see them more commonly. Maybe Dr. Romo could start, and then Dale or Dave, if you want to kind of say what your experience has been, that would be great.
Yeah, so I'll try to kill two birds or two questions with one stone because I see one on the chat that can also be answered.
Great.
So I have LCTR1 mutation, but no schwannomas yet. So as I mentioned during the presentation, schwannomatosis has variable penetrance and expressivity. So it is possible that even if you have an LCTR1 mutation or pathogenic variant or a SMARCB1 for that matter, you may never develop schwannomas. But if you do, it is possible that new schwannomas can occur during lifetime. And we have much, much yet to learn about the natural history of schwannomatosis, especially because of what Dale mentioned, misdiagnosis, late diagnosis. And so a lot of the times we don't capture the natural progression of schwannomatosis in children and young adults. So we have a lot to learn about how schwannomatosis affect those communities of patients, young patients. But yes, unfortunately, new schwannomas can develop over time. The schwannomas that are present may increase in size. Dale sent me an abstract, which was very interesting to read about how a study at MGH showed that some schwannomas may even shrink spontaneously over time as well. But it's not the rule that they will increase or decrease, but they can do all those things.
Yeah, thank you, Carlos. I'm going to give a quick plug for the, you had mentioned the NF registry, which is one of the goals of that is this natural history question that Dr. Romo is pointing out, which is that the more folks living with schwannomatosis that we have as part of the registry or participating in clinical trials, being seen at our comprehensive NF centers, the better we can do of really gathering that information and seeing the impact of this over the kind of the lifespan. But Dale or Dave, if you want to add anything to that kind of question of when these show up and how that has been a part of your story, please feel free to chime in.
I'll just do a quick one on the main one for me was my brain. I had a tumor in my brain on my left trigeminal nerve. I didn't in 2010 when I first met Dr. Plotkin, I went up to Boston to get, and that's I found him myself, and then I started seeing him because he has to because the NF clinic's up there, and he said you need to get a brain MRI because you haven't had one in a while. So I went and got a brain MRI, came back, it was fine. This was in 2010. And then I didn't go see him for a while. It was 6 years. I was just living my life. And then all of a sudden I started getting pain in my left eye, like stabbing pain. And obviously followed up with doctors, and it showed that the tumor that was like a little dot just blew up and was pushing on my brainstem. So we had to, even though I didn't have cancer, we had to address it right away. It would have killed me basically. It would have cut off my brainstem. So just in that 6 years, it grew.
Yeah, sorry, I didn't mean to interrupt, Dave. I wanted to say that you actually, your story illustrates a couple of things. So one is that we know that the schwannomas generally are not cancerous and they are benign, but when they are growing in very tight spaces, like our brains where every structure is vital, they can start to cause problems, right? So that's a great example of why. And the other thing you've pointed out is kind of that regular checking in with a comprehensive clinic or a clinician who really understands what to be monitoring in schwannomatosis is part of why that's so important. So thank you for sharing that.
It wouldn't have stopped the tumor from growing, but at least I would have been on top of it a little better.
Sure.
If I kept seeing Dr. Plotkin at least once a year.
Yeah. Well, access to care is a huge part of CTF's mission and trying to constantly expand where these clinics are because so many people don't live conveniently near a clinic or their insurance doesn't let them go to the clinic that's closest to them, all kinds of problems. And it's something we're very committed to trying to really change for this community. So thank you. I thought I would move us to some of the questions around diagnosis and testing. And you did such a nice job, Dr. Romo, kind of going through this. And I'll just second what Dr. Romo said, which is that kind of the diagnostic process and understanding the genetics of non-NF2 related schwannomatosis is so complex. And that's why it's so important. I'll second what he said about meeting with a specialist, talking with a genetic counselor, really trying to understand your specific situation is going to be much easier and more helpful than maybe trying to understand the breadth of kind of complexity when it comes to the genetics of schwannomatosis. So, okay. So you kind of answered this, Dr. Romo, but I maybe wanted Dale to, or sorry, it was Dave, kind of chime in a little bit. But we had talked a little bit about, like, if you're genetic testing, let's say your blood test or your saliva test has come back negative, meaning we're not seeing schwannomatosis. Does this mean like that I don't have it? I'm in the clear, it's something else?
Not necessarily. So it is possible that you don't have it. It is possible, but it is also possible that you may have a mosaic form of NF or schwannomatosis in this case. And as I explained to you, that means mosaic means basically that some cells are affected in your body and some cells may not be affected in your body.
Mm-hmm.
So let's imagine this. If your cells lining your cheeks are not affected and we do a cheek swab, then the test is going to be negative because those cells are quote unquote normal. They don't have the mutation. Mm-hmm. But if we test the tumor here and the tumor in your chest, and both of them share the exact same as SMARCB1 or LSD1 mutation, then we will be able to confirm your diagnosis there. So no, a negative test does not exclude the possibility that you have schwannomatosis, unfortunately.
Mm-hmm. Yeah, thank you. And Dave, this was a little bit of your experience, yes?
Yep, exactly. That's exactly how it happened. They did my blood work at Greenland Genetics. It came back negative. I went back to Dr. Plotkin. He suggested that I get the tumor tissue tested. When I tested the tumor tissue, it came back mosaic LZTR1 for me.
Mm-hmm. Yeah. So we have a question in the Q&A that I want to bring to the group and say about the frequency of MRIs, especially given Dave's story that he shared of the tumor in his brain. What are the recommendations, generally speaking, of frequency of MRIs? There's always the question of whole body MRIs. And so maybe, anybody who wants to kind of respond to that, maybe starting with Dr. Romo, about whether there are some kind of standardized guidelines for this.
There are a few things that I would say are pretty much guidelines for us. And one thing is that as soon as you're diagnosed, we probably want to have a dedicated MRI of your brain with a special protocol looking at your inner auditory canals. And that is very thin slices of your brainstem, because people with NF2 related schwannomatosis, and like I said, LCTR1 schwannomatosis can have cranial nerve schwannoma. So we want to rule that possibility that it's NF2 or that you have other schwannomas like Dave was mentioning. And in SMARCB1, in some cases, people can develop meningiomas. And so the MRI of the brain helps with that. So I always recommend, as soon as you're diagnosed with a form of schwannomatosis, an MRI of the brain with thin cuts of the IACs, the internal auditory canals. I also obtain an MRI of the spine because, as I mentioned in my presentation, there could be schwannomas that are forming in the nerve roots as they're exiting the spinal cord. And I want to make sure that none of them are actually compressing the spinal cord. If the brain MRI and the spine MRI initially are negative and there's no tumors whatsoever, then I relax a little bit, back off, and don't get MRIs every year or two. I might get MRIs if I examine you in clinic, I do my neurologic examination, and I ask you questions that worry me. In that case, if there's something worrisome, I would order a new MRI of the brain or the spine. Regarding the question of whole body MRIs, I think it's appropriate to get a whole body MRI at least once to assess how many tumors you may have, and then assess if there's any of those tumors that are looking concerning. As I mentioned, most of the tumors are benign, and as Dave and Kate, you mentioned before, they can compress in structures and cause trouble because of their compressing other structures like the heart, the lungs, the trachea, things of that sort. So you want to make sure that you understand where are tumors and which ones do we need to monitor more closely and which ones are not that worrisome. And that paired with your symptoms is what should guide your physician on how often you should get MRIs and which kind of MRIs you should get. So it's not one size fits all. I think it should be a little bit personalized, but I think whole body MRI once would be great. If you can have access to that, brain and spine MRI at least once should be ideal as well.
Awesome. Thank you, Dr. Romo. Dale, do you want to speak to this a little bit?
Yeah, my initial tumors were found in the sacrum, and then we did a follow-up of the spine, found a couple, and we did, I think, 6-month intervals to see that they weren't growing. Went to a year, saw that one was growing, went back to 6 months, went another 6 months, saw that it actually decreased. So then we extended back out. So it's, to your point, it's sort of a personalized experience.
Yeah. Can I ask for Dale and Dave, there's a question in the Q&A about this, and so I thought it would be nice to have you both share your part of this story is really about accessing care. So I'm curious for the both of you, I think you both travel quite a bit for the majority of your schwannomatosis care. So curious how you came to the decision, how far do you travel? How did you decide that that was what you were going to do? And did you struggle to get insurance to cover any of this if you're leaving your state, et cetera? And kind of what does that look like for you?
I know that on the Schwannomatosis Facebook page, I know people talk about that a lot. I get frustrated because I wish I could help them and give them, fly them out there or whatever. But I think it's all about yourself. You really have to do the diligence yourself in finding out what's the best way to get to places. When I first got diagnosed, I was in Philadelphia. I was living up there. I got diagnosed by a doctor, a genetics doctor at University of Penn. She referenced when I told her I was moving, she gave me, the information down in South Carolina. And then it was a lot of me doing my own work, getting on the NF registry and finding out where places are. I could have picked different places to go to that were closer to me, but I figured Massachusetts General Hospital is one of the best. So that's how I started. So I think I know it could be hard, but, you just have to hit all angles and stuff. I mean, luckily I have a good job and I have good insurance and stuff like that, and it covers a lot of the stuff. But I'm sure there's people out there to help out stuff too if you can't afford it.
Right. How about you, Dale?
Self-referred to, I live in Minnesota, so I basically did a quick Google search and found University of Minnesota and Mayo Rochester. And Mayo Rochester's marketing on their webpage is a little bit stronger than what the U of M had. I could have probably been treated at both places, but fortunately it was a short drive to get to Mayo, and I was quickly diagnosed. They were very familiar with schwannomatosis. So I think, part of what the CTF is doing with the NF clinics, is helping them market themselves, make sure that they're, promoting the right information. What do they treat? So that when people are on their diagnostic journey, that you may be at the right website, but you may not catch it, and you may start moving on, and it continues to delay your process to get to the final diagnosis. So
Yeah, thank you both. I did drop the link in the chat for everyone. CTF does have the NF Clinic Network, which is a network of about 70 plus clinics across the US, couple in Canada, that specialize in treating all forms of NF. You'll be able to see on the website, you can specifically search for clinics with more expertise in schwannomatosis, since it is more rare than some of the other forms of NF. And then also, of course, reach out to me directly anytime if you're struggling to kind of, manage if the website's not making sense to you, or if you're just not finding anything near you. Please feel free to contact me directly. My contact information is in your confirmation email for this webinar today. So thank you both for talking a little bit about that. We had a question that we had kind of come up with ahead of time that I think is really interesting about if I had genetic testing done, say 10 years ago, and there's this new criteria and a new understanding of how we kind of diagnose and talk and name schwannomatosis. Do I need to have updated genetic testing? Do I need to do that again?
I think genetic testing is helpful. It's not necessary to do genetic testing in everyone, so I don't think everyone should be frustrated if you can't get genetic testing, especially if your insurance is not covering it and it's very expensive. But genetic testing is helpful for a couple of reasons. I think the more we learn about how the natural history of schwannomatosis evolves over time, the better we will get at treating people with schwannomatosis. So understanding your specific type of schwannomatosis can help with that. It can also help predict a little bit about your risk for meningiomas, for example, and cranial nerve schwannomas, because those happen more in one versus the other. Some people think that maybe SMARCB1 is a little bit riskier in terms of cancerous transformation. But like I said, I've had a patient with LCTR1 who actually developed cancerous transformation of one of his schwannomas. So I think it's important, but it's not going to necessarily affect your care completely if you don't have it.
Okay. Yeah. Thank you so much, Carlos. Okay, so let's talk a little bit, because there's definitely some questions coming in about treatment options, management, and I want to make sure we save time to talk a little bit about the pain issues that we see with schwannomatosis. So to start, I guess we'll talk a little bit about whether schwannomas need to be removed, which you did mention in your presentation, Dr. Romo. And so maybe Dale or Dave, if you want to share kind of when you've had a schwannoma removed or not. Are there medications that are at least being researched? And we know there are no FDA-approved treatments that might shrink a schwannoma, but is there anything promising or in research right now that we should look forward to? So what kind of both surgical and medical management of the schwannoma tumors themselves and what's on the horizon or available right now?
With me, with the way I treat my pain is I see a chiropractor, I go to physical therapy, I do that kind of stuff. But I also got to a point with one of my tumors where it's deep down in, and I know that it's really be too hard to have surgery on. So when I talked to Dr. Plotkin about it, he brought up the Starfish trial, and I'm on it right now. I'm right in the middle of it. So I would suggest that, people take advantage of those if they can get into drug trials. But yeah, it's just, you have to manage that however, the easiest way to do it. But if it gets painful enough where, obviously my brain tumor, I had to get taken out, and I have a tumor in my arm that I had surgery on, but that one grew over the years and it was just causing me more and more pain. So I had to get it out. But I agree with Dr. Romo that there's certain ones that are going to be in me forever, and if it's not worth getting surgery on.
Thank you, Dave.
Couple surgeries, took out the painful schwannomas, and fortunately have been pretty mild pain ever since. I would say after my first surgery, I think I took one pain pill and I was like, I don't need to do this. I did not realize how much pain I had been enduring. And I think there's other, hip replacements, whatever. People have also said, wow, didn't need to take any pain medicine because of the relief from that surgery. So I think finding the right surgeon, if it's a smaller institution, if you can try to find a second opinion, I think it's always doctors will, a good doctor always suggests that you get a second opinion.
Yeah.
And then do your research, try to find the best options for yourself.
Yeah, well, I very much agree with that, Dale. I'll second that when you're making big decisions about your own healthcare, that it's very important that you work with clinicians who, are comfortable with you going to get a second opinion and who are valuing, the questions you're bringing to those appointments and making sure that you feel like you're an important part of that decision-making process when it comes to whether you're going to have a surgery, whether you're going to look into a clinical trial, things of that nature. You really want to have a clinician who's willing to partner with you. So that was great, Dale. Thank you. And then Dr. Romo, are there any medical management options or medications on the horizon yet? Or what should we expect?
Yeah, so in terms of clinical trials, unfortunately, there aren't many clinical trials. Like I mentioned during my presentation, you should be familiar with the Starfish clinical trial. It's currently the only one that's currently recruiting for an interventional evaluation of medications. There's 2 medications that are being studied right now, and both of them are aiming to treat the pain associated with the schwannomas, but not necessarily shrink the schwannomas. In the lab, there are different labs across the US and in Europe and other places that are evaluating treatments specifically for schwannomatosis, but those are not yet as part of clinical trials. And that would be the first step, clinical trials, before they are widely available to the community.
Perfect. Thank you so much, Dr. Romo. I appreciate you just speaking to that. So there were some questions about known incidents, and I remember from your slide, Dr. Romo, that there were some known incidents for both LZTR1 and SMARCB1. Is it correct to say that for the other forms of, chromosome 22 and the NES, NOC, are those we just don't have those numbers yet? Is that correct?
Right. Even for the ones we know the incidence, we can't say that that's an exact representation of the incidence. That's what we estimate the incidence is as best we can. But as Dale and Dave can attest to, a lot of people are not diagnosed. And so I think we're under evaluating the actual incidence of these conditions. And there are probably out there more people that we just don't know have schwannomatosis because they haven't been diagnosed yet.
Mm-hmm. Mm-hmm. Yeah, we do absolutely see over and over again that part of the journey with schwannomatosis, unfortunately, tends to be a delayed diagnosis and misdiagnosis and a lot of that. And that's always very frustrating, and part of why it's important that we're doing things like this to raise awareness and to provide education and resources for folks to be able to advocate for themselves. So I think what I'm going to do is we have about 9 more minutes. And I think what I'd like to do is to Dale, well, and of course you as well, Dr. Romo, but for Dale and Dave, specifically, I'd love to know, and this might be a surprise, I don't know if you know I was going to ask you this, but I'd love to know one thing that you think has made the biggest difference when it comes to your kind of journey with this diagnosis and feeling empowered or hopeful, something that has made you kind of want to get back up again and join things like this when I reach out and ask for your time and attention. But what's something that has encouraged you or been important as a part of that journey?
Given the platform the CTF has developed over decades, right, to try to connect people maybe before the internet, with the internet. Webinars now I think are beautiful. Rare diseases, we're one of 7,000 plus rare diseases. So I think if you cannot find a schwannomatosis partner, you may find a friend that has another rare disease that has a lot of the similar sort of paths. So I think be open to listen to others, to let them share their rare disease story with you, and it gives you an opportunity to share yours, and you learn more.
That's great. Thank you, Dale. I love it. How about you, Dave?
Yeah, I definitely like meeting Dale and Rebecca and Jason when we were at the NF Summit last year was amazing. I've never met anybody with schwannomatosis. I might have saw a couple people in chats, but to actually sit face to face and me and Dale talk about it, it helps, you know what I mean? So I would recommend that, anybody that, is dealing with this stuff to just keep hooked in with the CTF and go to any events that you can go to, watch the webinars and everything like that. I mean, it's really important. I know before my brain surgery, I didn't really pay much attention to stuff. And then obviously after my brain surgery, because I could have died, I definitely changed my outlook on making sure that I'm, plugged into everything that has to do with schwannomatosis, as much as I can while I'm, working and taking care of my son and got remarried. So, but basically you got to be an advocate for yourself, like Kate was saying, because you can't expect that people are, going to do stuff for you. You gotta take advantage of the resources on the computer and stuff like that, and go to what do you call it, an NF clinic, and get a genetics doctor. They're the two main things I think made a difference with me.
Yeah. Thank you, Dave. That was fantastic. I appreciate it. And then Dr. Rome, I'm just going to do one more question lobbed at you, which is that I would love to hear, and probably everybody I think would be interested to know, what brought you into this particular field of study? Why did you end up, with all of us here in the world of NF?
Yeah, I was not planning on being in the field of NF. I knew I wanted to be a neurologist, and that's what I am. I trained as an adult neurologist, so I take care of adults with neurologic problems. And then I also became interested from doing research on cancer. And so I wanted to merge those two interests, cancer and tumor biology with neurology. And there's this subspecialty of neurology called neuro-oncology. And so you can study to be a neuro-oncologist, and primarily you treat people with brain cancers, usually not in the context of neurofibromatosis. But part of what a neuro-oncologist should do, and I encourage all neuro-oncologists to be involved in NF care, is exactly that: take care of people with neurofibromatosis. And I was fortunate enough that I trained as a neuro-oncologist here at Johns Hopkins, where we have a very large comprehensive NF center. And so I had the opportunity to meet a lot of people with the different forms of NF, and started working with Dr. Jayshree Blakely here at Hopkins on research projects. And that's what got me involved in NF. And I guess she needed help and said, why don't you stick around a little bit longer and take care of patients with me? And so I work closely in the NF Center, taking care of people with NF. And now these days, I would say 99% of my patients are people with a form of neurofibromatosis.
Fantastic. Thank you, Carlos. I appreciate you sharing that with us. So I'm just going to do a little bit of kind of close this up and do some housekeeping. I want to assure everyone that all of the questions that were asked today in the Q&A box, as well as the chat, does get saved and shared with me afterward. And so I always go through those. And if there are questions that we just really did not address at all, I do my best to get in touch with folks and try to follow up. You're also welcome to reach out to me directly at any time. Part of my role here with CTF is, kind of connecting with the community and making sure they're getting connected to the resources that they need. So a few little housekeeping things I'll say is that we did just release our totally brand new Diagnosed with Schwannomatosis brochure. It's a really beautiful book. I would encourage you to visit the website and check that out. We have a great resource center that's got a lot of things in there, and that new Schwannomatosis brochure was long overdue, so we're very excited to announce that it's ready to go. It actually will be translated into Spanish. It's not ready yet, but that is coming. And then I also want to mention that next week there's going to be another webinar that's presented by the NF Collective, which is a group of NF advocacy groups that includes CTF plus many other wonderful organizations, with Dr. Vanessa Merker, who's going to be talking about clinical trials in schwannomatosis, specifically thinking about pain and how we treat pain. So I'm dropping the registration information, thank you, Sarah, into the chat. You can click that link if you want to register for that. Also, the NF Summit, which thank you, Dave, for plugging that. That's our annual in-person patient and family gathering for folks living with all forms of NF. This year will be in Washington, D.C., June 19th to the 21st. Information about that's on the website, nfsummit.org. Also dropping that into the chat. It's a great opportunity to meet other folks in this community, and stay tuned because we have some very exciting and unique programming coming for specifically our schwannomatosis community that even Dale and Dave don't quite know about yet. So more coming on that. Yes, thank you. Good face, Dale. I also just want to mention that this is part of our NF Knowledge series. Every month we're going to be presenting on a new topic. Sometimes they'll be specific to one type of NF. Sometimes they'll be broad and applicable to everyone. So visit our website to kind of get the complete calendar for that. As well as we have a whole page on the ctf.org website specifically for schwannomatosis. So be sure to check that out for more resources as well. And last, be sure to sign up for our newsletter. This is a great way. It's just an email. We're not going to overrun your inbox with a bunch of stuff, but it just is going to keep you in touch with what's happening, the research we're funding, the progress we're making, and really keep you in the loop. So with all of that being said, thank you very much again to Dr. Romo, to Dale, and to Dave, as well as to everyone who joined us today. This was a wonderful conversation. I hope it was as beneficial to everyone else as it was for me. And I hope that we will see you at the NF Summit and back here for more webinars. And yeah, have a wonderful day, everybody. We'll see you
Come
next
to the NF Summit if you got schwannomatosis. Me and Dale are trying to expand our posse. There's only 4 of us.
Well, 4 was a record, so we're trying to grow. We want more than 4, so check it out.
Awesome.
Thank you, everyone. Have a great rest of your day.
Thank you.
Bye.